Hello everyone, I'm Dr. Karishma Kagodu, board certified plastic surgeon at Dr. Karishma Aesthetics in Bangalore. Today we are going to discuss in detail into what is gynecomastia, why it happens, how it happens, and how it can be treated. Gynecomastia is a very common condition seen in men of all age groups. It is seen in more than 60 to 70% of boys in the puberty age group, and it's seen in a large population even in adulthood at 50s or even 60s. So what is gynecomastia? It is an abnormal benign enlargement of the male breast gland. In boys as well as girls, we have two very important hormones, estrogen and testosterone, and during the puberty age group, the estrogen in women become higher, and because of the high estrogen leads to the development of breast gland tissue. But in males, the testosterone is what spikes and the estrogen lowers, and that prevents the development of a breast gland in men. So in gynecomastia, you have an abnormal hormonal imbalance happening between the estrogen and testosterone hormones, which can happen due to various reasons. And that is why if there is an abnormal imbalance and there is a higher estrogen or prolactin in men, you will see an abnormal enlargement of breast gland tissue. So now let's move on to what are the important triggers causing a gynecomastia and what are the causes of this male boob issue. Now, most important reason could be just obesity by itself. Obesity in the body causes a hormonal imbalance, and this hormonal imbalance can lead to an abnormal gland tissue enlargement in the men underneath the nipple region. Now, in most cases with this obesity, along with the abnormal gland which has overgrown, there is also fat which deposits around the chest and other areas of the body. So most of the men may think that this is just fat in the chest. Now, to understand whether it is actually fat, is it gland, or both, one has to make an attempt to try to lose as much weight. Now, we see in most case scenarios when boys from the pubertal age group start losing the fat and they lose all that baby fat in the body, they will also see all that puffiness in the chest which goes away, and they know that that is only fat and not a gland. That means it was not a true gynecomastia, it was a pseudo gynecomastia. So number one, obesity causing hormonal imbalance is one of the top reasons for male boob formation. Number two, certain medical issues and chronic illnesses in the body can also stimulate that gland underneath the nipple to develop. One important drug is also called as spironolactone. There are certain drugs which are used for cardiac and heart issues in adulthood, and that taken for a long period of time can cause the gland stimulation and make it enlarge. That is why we may see gynecomastia not just in puberty age but also in adulthood. One of the very common reasons for this gland enlargement is men is chronic overuse of steroids. So I have a lot of patients, those who are already muscular, well-built, athletic, and many of them are bodybuilders or trainers. They have intake of anabolic steroids, sometimes testosterone. When there is a chronic intake, long-term intake of anabolic steroids, artificial testosterone, artificial growth hormones, and that is one of the major cause of this gland overgrowing in the male breast. So for you guys out there, how is it that you are going to recognize and understand when you do have gynecomastia? How will it show up? So it's very important to know 2 or 3 important signs of gynecomastia. One, a firm lump which is felt underneath the nipple. This lump which is gradually increasing in size. Number 2, the nipple and areola seems puffy and it is enlarging the areola. Number 3, there could be a little pain felt behind the nipple area. Number 4, you will also see some sensitivity issues, and certain times the nipple area would be oversensitive. Well, besides all the physical symptoms which happen for a man, there is obviously a very big psychological impact which takes place even in younger boys. So I have encountered 2 age groups of boys, one in the puberty age group as young as 16 and 17, who are getting teased in school by their peers and other boys in school about their big chest and the big gland tissue. So they hesitate to participate in sports, they hesitate to take off their t-shirts in front of their friends. Now again, you have young men in their 20s or even adults at 40s or 50s who get a lot of social embarrassment because of their chest looking feminine. Gynecomastia and the gland enlargement is not something that you can take away with any kind of workout or exercise. Now, if you look at bodybuilders and athletic men who come for gynecomastia removal, you will wonder, they do so many exercises, so many workouts, but still it doesn't go, and surgery is their only option. So remember that the psychological impact of gynecomastia on the men is tremendous, and most of them suffer from a lot of social embarrassment, and due to these various embarrassing situations, many of them approach us to get this treated. If you are concerned that you have a gynecomastia or male boob issue and you are confused about it, I suggest you come meet us, get a consultation, and we'll do a thorough medical evaluation and workup on you to understand and also examine you to know whether it is a true gynecomastia or is it a pseudo gynecomastia. So I will usually work up my patients by one, doing a clinical examination. Second, we are going to do a thorough medical blood test. We will also do an internal hormonal blood evaluation to know all your hormonal values. We will also do an ultrasound of the chest region. We will rule out any internal medical illnesses that you've had. What is the past medical history? Are you on any long-term drugs and medications? And all of these detailed workup will help us reach a diagnosis as well as what is the cause of gynecomastia. And let me tell you, in 90% of the cases, there is no direct cause of gynecomastia. It could probably you being a little obese or a little on the heavier side and a heavy BMI causing the hormonal imbalance. But the rest 10 to 20% of people can have hormonal issues which will show up on your blood investigation. So visit us to first of all help you understand whether you are suffering from this issue, and then we will do a thorough workup and evaluation on you and reach a thorough diagnosis. So as we've discussed it in detail of to why gynecomastia happens, how it happens and when it happens, watch out for my part 2 video on gynecomastia, where we will discuss about what are the treatment options for you, medical options, surgical options, and how would your recovery be after a gynecomastia surgery. If you like this video, do not forget to click the like button below. Do subscribe to our channel, Dr. Karishma Aesthetics. If you would like to reach out to us and meet me in person, visit our website www.kaesthetics.in. Follow our Instagram channel dr.karishmakagodu, and do like, share and subscribe.